The $14 Revolution. How generic semaglutide could transform global public health. For years, the medical community has viewed semaglutide, the active ingredient in blockbuster drugs like Ozempic and Wegovy, as a luxury. While these GLP-1 medications have revolutionized the treatment of obesity and diabetes in wealthy nations, their high price tags kept them out of reach for much of the developing world. That is changing rapidly. Following the expiration of a key patent in India, a massive shift in drug accessibility has begun, potentially turning a high-end medical breakthrough into a global public health tool. The price gap closes the economic disparity between the US and India regarding semaglutide is staggering. In the United States, where patents are protected until 2032, the drug can cost as much as $349 per month without insurance. In India, the landscape has shifted overnight. Generic availability. Within days of the patent expiration, at least 6 Indian drug makers launched generic versions. Projected competition. More than 40 manufacturers are expected to enter the market soon. Affordability. The cheapest generic versions are already hitting the market for approximately $14 a month. This price drop is not just a minor adjustment, it is a fundamental shift. For a country where the average monthly spending per person ranges from $44 to $75, the original branded prices were impossible for the vast majority. Beyond weight loss, a metabolic lifeline. While popular media often frames GLP-1 drugs as weight loss shots, their clinical value lies in their ability to treat a cluster of metabolic conditions simultaneously: obesity, type 2 diabetes, and cardiovascular disease. This intersection is critical for India, which faces a unique and mounting health crisis. Diabetes. Over 100 million Indians live with diabetes. Obesity. Roughly 350 million people are living with obesity. Cardiovascular risk. Heart attacks and strokes claim 2.8 million lives annually in India, often striking a decade earlier than in high-income countries. Crucially, research shows that nearly 43% of Indian adults fall into a specific category: those who may not meet the standard definition of obesity, but suffer from metabolic obesity, high blood pressure, and insulin resistance despite lower body weights. For this group, semaglutide offers a targeted medical intervention that traditional weight loss approaches might miss. Can it move the needle on a national scale? There is precedent for the impact these drugs can have. In the United States, adult obesity rates saw their first decline in recent history, nearly 3%, between 2022 and 2025, coinciding with the surge in GLP-1 use. India is uniquely positioned to replicate or even exceed this impact due to its healthcare structure. Unlike many nations where the government controls drug distribution, 80% of diabetes care in India is delivered through private providers. This means generic drugs can reach patients through pharmacies and private clinics, without waiting for slow-moving government procurement processes. Remaining hurdles. Despite the optimism, significant obstacles remain. The diagnosis gap. 1 in 4 people with diabetes in India remains undiagnosed. A low-cost drug is ineffective if the patient does not know they are sick. The poverty barrier. While $14 is affordable compared to $349, it is still an out-of-pocket expense that millions of the most vulnerable citizens cannot afford. Public perception. There is a tension between medical necessity and cosmetic desire. While doctors focus on treating disease, a segment of the public is driven by the desire for rapid weight loss for social reasons, which can distort how the drug is utilized. It's the excitement of treating disease that is driving the doctors. It's the excitement to lose weight that's driving the public. Ambrish Mithil, endocrinologist. A global trend in motion. India is not an isolated case. As patents expire in countries like Brazil and Canada, and as many nations in the global south operate without patents entirely, the Ozempic era is transitioning into a generic era. If these drugs can successfully dent the rising curves of diabetes and heart disease in a country as large and complex as India, it will mark one of the most significant public health victories of this generation. Conclusion: the arrival of affordable generic semaglutide in India marks a pivotal moment where high-science medicine meets mass-scale accessibility, offering a rare opportunity to combat a global metabolic epidemic.